So part of the question is, what is marketing and what is healthcare communications? How are these things different? How are these things different? How are these kinds of communications defined, and what are the different ways that they can be taking place? What are the different changes in the regulations depending on what the communication is? In terms of HIPAA, the question is, what are some of the marketing limitations? What are some of the things that you would call marketing, and what are some of the things that you would call healthcare communications that wouldn't necessarily be considered marketing, even though they may sound like marketing when you just look at the definition. And so we'll also look at how email and texting can work under HIPAA, because you have obligations under HIPAA to be having patient communications that are handled in a secure way. And so we'll have to see how this works out when you're involving email and texting and you're communicating with your patients. How do you work that out? And we'll look at some guidance from HHS as far as what they have in mind for how you're supposed to handle patient communications. That's obviously a key part of what we're talking about here. And also be considering what's under the Telephone Consumer Protection Act and CAN spam. A TCPA was put in place in 1991, and that has to do with, in large part, things like robot calling devices, robocalls, which back in 1991 were a huge disturbance to life in the evening. Your phone would ring all the time, and back in those days, caller ID was not something that everybody had at all, and the phone would ring at dinner time. You'd have to answer it and say hello, and of course there'd be some kind of recording there that would try and sell you something, and it was just infuriating. And so TCPA was put in place to deal with that. Also at the time, though, they also looked at cell phones, and when you think back to cell phones in 1991. The cell phones, you didn't pay for your data. You paid by the minute for your calls and by the character for your text messages. And so if somebody was going to call you and leave you messages or send you text messages on your cell phone, these are the kinds of things that could very easily use up all your allowable minutes and characters for your calls and text messages, and then you'd be left with nothing left under your plan and be charged a huge overage expenses for speaking too long or texting too much, which, I mean, these days, this problem has kind of gone away, right? I mean, nowadays we pay for data, and the minutes and the texts are basically for free. They kind of throw that in as here, you can have all this for free, and now let's talk about the data, because that's what everybody uses these devices for these days. So, a lot of what's under TCPA may be kind of obsolete, but it's still there. But you have to make sure you consider what's in there. And there are different considerations depending on whether these are calls that are for billing purposes and follow-up purposes for getting paid, versus calls that are being made for healthcare purposes, such as follow-up on particular recommendations or reminders of upcoming appointments, things like that. So we'll look at all those details about what's under TCPA. We'll also be looking at CAN spam. That's the law that was put in place to deal with the deluge of junk mail we all used to have a long time ago. Nowadays, at least the junk mail is identified as to who's sending it, and you have the opportunity to say, please don't send me anymore, which is an important thing to be able to say, hey, stop it. I don't need to hear from you, 12 times a week about something that I don't ever do, okay? So anyway, it's nice to be able to have some control over those things. That's where CAN spam comes in, and that's one of those things that can affect you, because if you send out something that might be considered marketing in email, you may have to consider about CAN spam. So you have to make sure you take it very carefully and take it very seriously. Now, if something goes wrong under HIPAA and you wind up exposing somebody's information in the process of all these communications, exposing the fact that they are your patient perhaps, or that they're receiving some kind of treatment or anything like that, that's the kind of stuff that might have to be reported as a breach under the HIPAA regulations. And so we'll see, what is the process you have to use to be able to think about, well, is this something I have to report or not? Is this a reportable breach? And if it is reportable, then what do you do? And this is really all about, when we're looking at all the regulations, it's all about understanding how to be ready for things like enforcement activities and auditing. The fact of the matter is, if somebody makes a complaint, or if HHS decides they want to do, just ask some questions, they have the right to do auditing. It's in the law. They're supposed to be doing it, even though they've sort of canceled their plans going forward for an organized auditing program, which, I guess it's interesting how they just decide to drop something that is part of what's in the HITECH Act. But anyway, look at, they can also look at, look at enforcement as a kind of that is continuing no matter what anyway. And folks at Health and Human Services are saying, oh yeah, no, we're still going full bore on enforcement, so don't try and get away with anything. So the idea is be ready for any kind of questions to come along, and you have to be understanding, what do you have in place to meet all the requirements, and what do you have in place to show that you've actually been using those policies and procedures to actually meet those requirements. So it's all about how do you approach compliance. It's having the right things in place to enable you to have the documentation to show you understand what the rules are and you've been using them. It's a nice capsule kind of definition. We'll have some time at the end, of course, for some questions and answers, so please keep track of what you're thinking about. I don't need to spend too much time talking about myself, just that I'm an engineer, not a lawyer. So this is not legal advice. I'm just providing some information and resources based on my experience of working with a wide variety of healthcare-related entities over what, my goodness me, it looks like it's half of my professional career now has been spent in HIPAA, including almost 18 years specifically in HIPAA. So anyway, I have lots of stuff available on the lewiscreeksystems.com website. All kinds of resources and news stories and toolkits and guidance and stuff like that. Anything is available and I think is important for understanding or having available to you for HIPAA compliance or for healthcare information, privacy, and security regulatory compliance in general. I have a lot of stuff out there on the website. So look at it this way. Anytime I come upon something that I think I want to be able to look at again later, that I might want to be able to reference or use or recommend to somebody, I put it out on the lewiscreeksystems.com website on one of the resource pages or on the news page, because then those things are available anytime, any place. If I can get my hands on a computer, I can find those things for somebody. Okay, and it also means that, I can find that stuff myself. I mean, that's the nice thing. That's the whole, why I do it myself is so I can find it myself later, rather than having to, have some Byzantine organization of bookmarks or something like that. I actually lay it on the website for me to be able to find, but it's available for you too as well. So take advantage of those resources. They're something that's good for you if you're in the healthcare privacy and security compliance game. That's all there is to it. So what we're talking about is HIPAA privacy and security rules, okay? Because this is the foundation for all our discussions that we have about HIPAA compliance. Privacy rules have been around, well, let's see, enforceable for coming on 15 years now. So it's going to be an old man, and see, you have to understand now, around 10 years of age is when stuff in the government starts being enforced. The first 10 years is kind of like, okay, we're getting ready for this, right? You all understand we're going to have to be in compliance with this, right? Okay, now here's how you be in compliance. Let's keep thinking about this. And about 5 years ago, they started getting serious, okay? And so it's been enforceable since 2003, but it's been serious business for at least 5 years now. There's no getting away from the regulations anymore. You can't possibly hope they'll just go away. It ain't going to happen, okay? Especially when you look at the privacy rule, it sets up the framework of the relationship between people who have health information and the organizations who are holding that information. It says what are the rights the individuals have for